My name's Toby Hall. I'm a manipulative physiotherapist and I teach manual therapy to postgraduate physiotherapists with courses in various forms of manual therapy for back pain, neck pain, headaches, various kinds of problems where we focus on using manual skills to treat musculoskeletal conditions. Manual Concepts is an organisation that a colleague of mine, Kim Robinson, and I set up back in 1993. We ran our first course together with Peter O'Sullivan, and we ran a lumbar spine course. We felt there was a need to provide evidence-based postgraduate courses to physiotherapists to increase their awareness of manual therapy and manual therapy education. So we started in that time with a very short course, 2-day course on the lumbar spine, and then gradually we did more and more courses to physiotherapists in Australia, and since then we've been running courses in different countries. We've now run courses, I think, in over 30 different countries, all to physiotherapists at a postgraduate level. Evidence-based practice is where we use research that has been conducted into various different forms of physiotherapy, in my particular case manual therapy, which informs us how to direct our practice so that our practice has evolved over many years to be based on what we've found in terms of the research evidence. What makes a good manual therapist is dedication to improving manual skills. In one sense, I think manual therapy is really an art as much as it is a science. And if you see skilled practitioners in manual therapy, you'll see that they've been practicing that skill for many, many years. I think about the colleagues that I've worked with over time, people like Michael Monaghan, people like Brian Edwards, people like Kim Robinson, Bob Elvey. All these people have chosen to improve their skills through very careful practice over time. So I think that's one aspect, it's careful practice, but I think it's also incorporating current evidence to ensure that the practice that we give is based on research evidence and it's not based on outdated forms of treatment that perhaps may not be effective. There are many kinds of headaches that we see in daily practice or people complain of in everyday life. We have 3 broad categories of headache that have been defined by the International Headache Association. We have primary headaches where there's no known identifiable cause. We have problems like migraine, tension type headache, medication overuse headache, common daily headache. These are headaches that are commonly described as where there's no known identifiable cause. The second group are the secondary headaches, where there is a distinct pathology that can be identified that's causing the headache disorder. And a classic example for physiotherapy is cervicogenic headache, temporomandibular dysfunction, and so on. And then a third group of headaches where we have the cranial neuropathies, where there's some kind of neural disorder involving the neck and or head causing headache. Physiotherapy can help a lot with some forms of headache. We know that there are different forms of physiotherapy for different headache types. So we think of manual therapy as being appropriate for some forms of headache like cervicogenic headache and tension headache. And the systematic reviews and meta-analyses show that physiotherapy in the form of manual therapy is very effective for those forms of conditions. Whereas other conditions like migraine do not respond so well to physical interventions such as mobilization or specific exercises, but it does respond well to general exercise. So although hands-on physical treatments might not be appropriate for some headache forms, other forms of treatment can be effective, such as pain education, and general exercise to improve and desensitize the central nervous system. My interest in examination and treatment of headache started with the Mulligan concept. Brian Mulligan has described some treatment techniques for managing headache disorders, and specifically he described a test to examine for upper cervical involvement in patients with headache, and the test we call the deflection rotation test. And I found this to be a very useful test in clinical practice, and I found the Mulligan techniques that Brian Mulligan described very helpful for some forms of headache. And this led me to learn and want to learn more about how we could use those treatments and which patients would be suitable. So I decided to do my PhD, and it's a very useful or very interesting area for me, so I decided to investigate the flexion rotation test. I'd done quite a lot of work with Kim Robinson before on the test, but just wanted to expand on that, and that's what led me into that area of research. So it was really Brian Mulligan that led me into that area. I think people that are inexperienced in management of musculoskeletal disorders need to expand their experience, knowledge, skills, and there are many ways they can do that. But we in Manual Concepts offer a range of courses to increase people's skills and knowledge based on sound evidence, and we can provide courses that run from short courses like we're running at the moment over 2 days up to 4-week programs where we can really expand people's knowledge in a very comprehensive way.